Good morning and welcome back to Mark 5, Policy Off Leash. This is Mark Cushing, where we discuss policies affecting veterinary telemedicine and virtual care. The first series covered the basics, where every state fits into the 7 different ways that practice acts have laid out the connection between a VCPR and telemedicine. Today we cover one subject, but it's complex, which is how did COVID affect telemedicine VCPR policies? We all know, of course, how COVID affected our life and our veterinary practices, and that's for another expert. That's not what I'm going to focus on today. But what did happen, starting with the middle of March of this year, let's remember that COVID sort of entered our life possibly as early as January or February, from a medical standpoint, but the awareness of its scope and scale kicked off around the second week of March. And since then, 27 states, so more than half of the states in America, 27 states, not by legislature, but by governor or public health department or veterinary medical board, took actions that affected, they did something about telemedicine VCPR policy. We remember, of course, that once the COVID virus was viewed as potentially a widespread national emergency, human healthcare was told, use telemedicine every way you can because of social distancing needs. 27 states thought the same thing about veterinary care as well. So veterinary services, as we know, were declared essential. That was important, right? If you're not essential, in most states you had to shut down, which has actually thrown a lot of American businesses out of business since then. Veterinary care across the country was deemed to be essential. 3 different types of actions were taken by these 27 states. Let's talk about them. The first one, and the most important in terms of impact, were 17 states, and you'll see a map that'll show you those states. You can see whether you're living in one of those states. 17 states suspended their restrictions on creating a VCPR through telemedicine, basically opened it up under the circumstances, consistent with proper social distancing and wanting to protect the safety of pet owners and, of course, veterinary staff and veterinary teams. And that's a wide mix of states. It goes from east to west, north to south, large to small, blue states, red states, everything in between. The next category involved 10 states. And those states didn't go that far, but they did, quote, encourage officially the use of telemedicine if you have a VCPR in place. Now, you can argue that that wasn't that tough of a stance, and I'd say you're fair there. They didn't change anything. They just encouraged people to use telemedicine. But actually, if you think about that, having the state government step up and say, for care of pets and care of animals, it's important that you use telemedicine wherever you can, reflected a belief in what? It reflected a belief that it's good medicine. Because if they thought it was bad medicine, if they thought it was going to harm the pet, I don't think a governor would have stepped up and even said encourage people to use it. So that's interesting. And then the next category was just a small number of states, 3, California, Georgia, and Minnesota, who had pre-existing time limits, which we talked about last week, pre-existing time limits of 12 months on how long a VCPR was in effect. Remember, if you saw a pet in January, the next year in February, you couldn't use telemedicine with that pet if you hadn't seen it physically again. And only 3 states have that rule, but those 3 did take the step of extending the 12 months to 18 months. And they did that so that if the 12 months was running out during COVID, and they didn't really forecast how long COVID was going to last, they didn't want to force you back into the clinic, which could be unsafe for the pet owner, or uncomfortable at least, and the same for the staff. So those are the 3 changes. And again, over half the states did something along those lines. Where we are now is in an era of uncertainty about how long is COVID going to last. in a meaningful sense. I don't mean until the very last person in America contracts the virus, but when we have a sense that we are going to a different stage of life in this country and rules and regulations and protections other than COVID alert and a COVID emergency. So the question becomes, when we reach that point, and some might think it's soon, some may say it's not so soon, will the policies go back to what they were before COVID started? Which means in those 17 states, are we back to traditional rules? You can only establish a VCPR through in-clinic visits and physical examination by the veterinarian, even if the veterinarian's comfortable doing it through telemedicine. And the answer is, we don't know for sure, but it is a good bet, let me tell you, that most states will say, well, the orders are no longer in effect. We'll go back to the prior status quo. But I can assure you as well, the door is going to be open now after 6, 12, who knows how many months of using telemedicine and no complaints about any harm. There'll be a good debate in all those states. Should we go back to that or follow human medicine's lead? And that's going to be interesting. And I think those 17 states are where you're going to see the most activity before we go to the other 33, I guess, and wonder if they'll too get in line with human medicine. So the Veterinary Virtual Care Association, a 36-member strong organization that was begun during COVID, and I was privileged to be one of the founders, has reached out to all those state veterinary medical boards and asked for evidence of any complaints that a pet was harmed or killed due to negligent use of telemedicine. Why is that important? Because we have a lot of theoretical debates about telemedicine, don't we? People predicting what's going to happen, people speculating what's going to happen. Tell you what now, we have 6 to 8 months of an actual laboratory in these 17 states in the United States. We also have next door to us a 15 million population Canadian province, Ontario, where you all know Toronto, a huge city that anchors Ontario. They've permitted the telemedicine VCR for 3 years. And we have evidence from their version of the Veterinary Medical Board as recently as August of this year. For those 3 years, there has not been one complaint, not one, that a pet was harmed or killed due to, quote, negligent use of telemedicine or the telemedicine VCPR. That's very powerful data. And the Veterinary Virtual Care Association is eager to have the discussion about telemedicine policy now shift from speculation and predictions to actually looking at the data and evidence, also from human medicine, to see if it doesn't make sense to expand its use. Thanks for joining me. Next session, we will tackle the question that's on many veterinarians' minds, which is, doesn't the FDA, the Food and Drug Administration, doesn't it set a rule out about telemedicine and VCPR? Let's see what the facts are there. See you next week. Thanks. If you want more information or even more fun to engage in an extended conversation with your colleagues about these issues, go to the Veterinary Virtual Care Association or vvca.org website, where our 3,600 member strong organization is engaging on all topics that concern telemedicine and virtual care for veterinary practices, not just limited to the policies I'm discussing, but how do you use it best? How do you implement it? How do you train your staff? What are the proper roles for all the staff members? And actually, importantly, how pet owners have reacted to it. We'll see you next week. Thanks.